is Tom Maher. Tom is the president and CEO of Practice First Management Solutions. He is a graduate of the state of New York at Buffalo with a degree of Bachelor of Science in Business Management. He has been a CPA since, I think, 1986. He's also a certified professional coder, which is a very effective qualification to have in the business he's in. Practice First has approximately 75 clients. Some are individuals and some of them are a group. It comprises over 600 individual physicians. In Tom's role as a practice administrator, he gets to see the ebb and flow of practice, not only through claims and reimbursement, but also through interactions with physicians and physician staff. And Tom, as I said, is directly involved in what has happened since early March when the COVID-19 directives came into force. Tom, I appreciate hearing your remarks.
Thank you, Fred. Thank you for having me, and good afternoon, everyone. I'll spend a little bit of time talking mainly from the business and money end of telemedicine. So, the COVID-19 pandemic created an extensive use of telemedicine technology, both nationally and locally in the Western New York area. While this technology has been in existence for years, this is a new concept for many. Medical providers that have used this technology in the past have seamlessly expanded this service form, while others that have not used this technology have quickly pivoted to offering this service. To evidence the shift, one of the largest providers of this technology, Teledoc, has experienced an increase in its share price since the beginning of the year of 134% to a $14 billion market cap. The Centers for Medicare and Medicaid Services, CMS, has greatly reduced the requirements for offering these services. For example, the video requirement to qualify as a telemedicine visit has been relaxed, although the annual wellness visit must still be performed using video.
Tom, can you get a little closer to your mic? Yeah.
Sure.
Yeah.
CMS has also minimized the HIPAA rules specific to the security portion of these visits. This has opened up these visits up to simple phone calls or the use of Apple's FaceTime, for example. Most insurance companies have begun to honor these visits as if they were performed in person. Pre-COVID-19, telemedicine procedure code reimbursement was typically allowed by many carriers, albeit at a significantly reduced rate to in-person visits. This changed rather quickly in early March, with CMS encouraging telemedicine by allowing providers to code and bill using regular office and hospital visit rates. Each carrier has their own rules and modifiers that must be ascribed to the claim for submitting these services to identify these visits as telemedicine. To encourage the patients to use this new service, co-payments for the most part have been waived. Let's talk a little bit about what the COVID-19 pandemic did to the volumes of certain specialties. So since mid-March through mid-May, the following specialties had this reduction in services. Primary care was cut in about half. Emergency departments were down about 60%. Surgeons and anesthesiologists down 90%. Specialists and urgent care centers about 70%. And behavioral health 0 to 10%. I'll touch on that a little bit more detail later. Since mid-May, we've seen a pretty good uptick in business. So we're approximately down overall about 25% over March, which was a relatively full month. So it's a notable improvement over April's numbers that were about 45% overall down. So providers offering testing for COVID-19 and or the serological test to detect antibodies to COVID-19 have really replaced some lost business, especially for urgent care centers. As the economy locally opens up, we expect many, if not most specialties to slowly ramp up their schedules to be back to a relatively normal schedule level of visits by Independence Day. Telemedicine will certainly continue to play a role in that increased volume. As the client so aptly put to me, the pathology of disease doesn't stop for coronavirus or anything for that matter. So the physicians in their practices extensively treating COVID-19 patients are as follows: infectious disease intensivists, hospitalists, emergency medicine, urgent care centers, and primary care doctors. From what I have read, a very small percentage of these providers locally have actually contracted the virus, thank goodness. As this wave of the pandemic crests and things return to what will be a new normal, there are many questions as to what will happen to this extension of service, such as, will telemedicine visits continue to be offered and what reimbursement rate? When will office copays be reinstated? Will patients prefer to continue using this service offering? While some of these questions will be answered through government policy, CMS has stated that they will honor these visits through the end of the public emergency declaration. We're not quite sure when that will be. Many carriers are looking at preliminarily end in June and July of this year with the option to extend. I've seen national carriers that are already extended through the end of September. Use of this technology will be affected by personal patient choice and community risks associated with going out in public. I would suspect that the relaxation of the security standards for these visits will be reinstated shortly, and this will have the effect of reducing telemedicine volume. For example, phone calls or FaceTime, I'm going to guess, are going to probably minimize. Generally, I believe that the copays for all specialties will be reinstated for telemedicine by most, if not all, commercial carriers. The desire for the patient to have skin in the game, is not going to recede due to telemedicine. Carriers really wants, the patients to have skin in the game. It'll basically be handled by practices keeping a credit card on file. Getting back to the behavioral health really lends itself to providing these services in this manner. I've talked to a few psychiatrists that prefer this model, since there's been a great reduction in no-shows that is very common to this specialty. Economically speaking, a lot of folks didn't really think too much about, everybody kind of thought about how businesses have taken a hit and so forth, but medical practices took the hit as evidenced by the numbers I mentioned earlier. Practices were really helped by, through two different programs. And the first was the Health and Human Services Stimulus Payment, Part 1, that was paid to most providers in early April 2020. The payment was made without needing to complete an application and was based on past Medicare annual payments. We've seen these payments anywhere from $7,000 to $20,000 per provider, depending on the extent of their Medicare business. Part 2 of the stimulus payment from HHS began to be paid May 15th, and that needed to be applied for. We're seeing numbers 2 to 3 times the initial payment, the initial Part 1 stimulus payment. The other program that was extensively used by medical practices was the Payroll Protection Program. This program allowed businesses to request a small business administration loan through their local bank and allowed approximately 2.5 months worth of payroll and benefits expenses to be considered. For the most part, these payments began mid-April 2020. So there's also a formula that will allow loan forgiveness for much of this loan based on payroll actually paid along with benefits, along with some occupancy costs in the 24 weeks that succeed the initial funding date. The balance of this loan will be repaid within 2 years at a very favorable interest rate of 1% beginning the month 7 after the date of original funding. One of the things about telehealth that I think that we're going to see is similar to the banking world. I'm old enough to remember, before we had ATM machines. Well, ATM machines, became a big thing, and more recently, online banking's become something that most folks use now. I think we're going to see the same thing in telemedicine. The technological world has changed a lot in the last 5 years, and a lot of folks don't even realize how it's changed, how quickly it's changed. And I think that, rapid adoption of this, and definitely more efficient, mode of service will certainly be expanded. So, in conclusion, regardless of everyone's personal political leanings, it was very impressive to see the government act with such alacrity to avert an economic catastrophe. It also appears that the government, including the Federal Reserve, appear willing to continue to spend. While no legislation is perfect, and there are always those that unfortunately fall through the cracks, this action, for the most part, achieved its stated goals. The hard part will be figuring out how to pay for it. That's it, Fred.
Well, thank you, Tom, very much. So at this point,